Hello, I'd like to introduce myself. My name is Michelle and I currently work as a trainee advanced nurse practitioner within primary care in a general practice situated in a semi-rural town in Lincolnshire. I have worked for the practice for almost 4 years, initially as a practice nurse and currently as an advanced nurse practitioner. The current practice population is approximately 12,600 patients, with a team of 6 general practitioners, 2 advanced nurse practitioners, 3 practice nurses and 2 healthcare assistants. The types of patients which I see in practice are patients with acute undiagnosed illnesses, and the training which I have completed so far within the Masters programme include the advanced physical and consultation skills, independent prescribing and minor illness. And due to this, it has enabled me to work independently and autonomously within my own competences. Working at this level brings a greater professional responsibility along with an increased risk of litigation, so it is really very important that I ensure I work within my competences, as this will reduce the risk of litigation. Due to a national shortage of GPs within the United Kingdom and in particular Lincolnshire, the clinical commissioning groups, the CCGs, the National Health Service and the Department of Health are supporting the role of advanced nurses to meet the needs of patients, but also to support nurses in their professional development. Today I would like to discuss the role of the advanced nurse practitioner, in particular within primary care, and how the role of the nurse has developed and changed over the years, along with changes within the NHS, which has driven the role of the ANP. My reason for choosing this topic is not only because it is personal to me, but is also in the forefront of the NHS, along with the ever-increasing demands which the NHS faces on a daily basis due to an increasing ageing population, which therefore brings an increase in patients with chronic health conditions, an increase in population since the start of the NHS, and the lack of capacity to meet these demands. This has forced the government to address this gap and therefore push for the professional development of nurses, paramedics, physiotherapists, occupational therapists and pharmacists into more advanced clinical roles, with the intention of bridging the gap to enable meeting these demands. When looking at how the nursing profession has progressed since its inception, where nurses were largely Catholic nuns compared to the bustling industry it is today, it is important to understand that the reason for this progression is due primarily to the added specialities and more advanced roles that current and prospective nurses can choose to focus in. Whilst in the late 1800s and early 1900s, those looking to become nurses would simply go to school and achieve a certification in nursing. The role of the nurse was not regarded at that point as an academic role, but a practical position providing personal care and following out doctors' plans for the patient. It was when the state registration of the medical profession began in 1858, many observers pointed to the need for a similar system for nursing. Support for the regulation of nursing began to become more widespread following the establishment of organised nurse training in 1860. Florence Nightingale is regarded as the founder of the modern nursing profession, when in 1860 she established nurse training at St Thomas' Hospital in London, where nurses were trained rather than providing a nursing service for the hospital. Student nurses doing their nurse training now attend university and can choose from any number of degrees to graduate with, such as a bachelor's degree in adult, learning disability and mental health nursing. This requires 3 years of study at university, along with a certain amount of community and hospital-based hours. Today's nurses also have the added opportunity of gaining a master's degree or even a doctorate degree in nursing. Each successive degree requires extra years of study, but should provide nurses better career opportunities within the field of nursing upon graduation, an advantage that only presented itself in the 1960s and 70s. The National Health Service was launched in 1948 offering comprehensive healthcare for all, which was free at the point of delivery but paid for through taxation. The NHS was the first universal healthcare system established anywhere in the world, and a leaflet was sent out to every household in June 1948, which explained, "The National Health Service will provide you with all your medical, dental and nursing care. Everyone, rich or poor, man, woman or child, can use it, or any part of it. There are no charges except for a few special items. There are no insurance qualifications, but this is not a charity. We are all paying for it, mainly as taxpayers, and it will relieve your money worries in your time of illness." The role of the nurse practitioner within the UK is a relatively new innovative development. However, this role was developed in the USA in the 1970s. The Cumberland Edge Report in 1986 recommended the introduction of the nurse practitioner within primary care and suggested that patients who visit their GP with conditions which are self-limiting or want to discuss other aspects of care should have a choice of who they see, and this was endorsed by the NHS Executive in 1993 when they reconsidered the future of nursing within the context of primary care. Within secondary care, nurses started to advance their nursing skills in the 80s and take on roles which were previously considered doctors' jobs. The reason for this was the introduction of the Working Time Directive and therefore the reduction in doctors' hours on the wards. To bridge these gaps in the services, nurses then had to take on more senior roles. In 1994, a report by the NHS highlighted changes in the healthcare with a reallocation of tasks between nurses and other healthcare professionals. Major reforms and policy developments along with the NHS Plan in 2000 identified the ever-increasing demands of patients along with the demands within the healthcare system and the government's drive to enable nurses to advance their knowledge and skills and work autonomously to meet these demands. The NHS Plan also identified that there was a need to remove traditional differences within the clinical roles whilst expanding the nurses' knowledge, and also the need to promote a more patient-centred approach to care. The Royal College of Nursing defined the advanced nurse practitioner as an advanced level clinical nurse who, through extra education and training, is able to work autonomously, make clinical decisions, and instigate treatment decisions based on those decisions, and is fully accountable for their own practice. Within general practice, advanced nurses were developed to meet the demands of patients who were requesting same-day appointments. The Department of Health expanded the nurse role to nurse practitioners who were trained to manage patients with undifferentiated medical problems. As part of the government's agenda for reform and modernisation within the NHS, pilot schemes were offered to train nurses into nurse practitioners and develop new services for patients in order to meet the demands within the health service. During this time, the GPs were able to reconsider ways in which they delivered the healthcare, with the opportunity for specialism in areas of interest and expertise in order to enhance patient outcomes rather than the traditional generalistic approach to care. Observational studies of nurse practitioners have found high levels of patient satisfaction with low levels of prescribing and little need to refer patients to the GP. Other studies which have shown that GPs have found that employing an advanced nurse practitioner has reduced their workload and suggested that this has led to more job satisfaction for the GP as a result of this. Recently, the NHS 5-year forward view has recommended more money to be invested into primary care, with the CCGs having greater control over the NHS budget. One of the areas where money will be spent will be around training more GPs. However, in Lincolnshire this has proven difficult due to Lincolnshire not being thought of as a desirable location for doctors to relocate to. They have resorted to offering financial enhancements for GPs to train in this location. Due to the national shortfall of GPs in the UK, this has increased the need to train other healthcare professionals such as nurses and paramedics into more advanced roles roles such as specialist nurses, advanced nurse practitioners, emergency care practitioners, along with the new role of the physician associate to bridge this gap both in primary and secondary care. When qualifying as a nurse, we enter the Nursing and Midwifery Register. Additional qualifications such as non-medical prescriber are added to the register to protect our title. However, there is currently no recordable qualification or protection of the title of the nurse practitioner by the nursing profession, and because of this, it has led to confusion about what an advanced nurse practitioner is and what we do by both the nursing profession and other professional groups. This also creates an issue of public protection and arguably clinical governance, with equality being a major theme throughout the NHS, yet there is still no standardisation for this role which stipulates the quality and level of qualifications required to practice as an advanced nurse practitioner. In the absence of this statutory standard, the scope of practice and use of the title advanced nurse practitioner, which varies in quality and quantity with concerns over the widely differing educational preparation undertaken by individuals, which range from a short in-house course to being qualified to master's levels. While the role of the nurse in the world has expanded dramatically within the last 2 centuries, it is clear that nursing will continue to grow into an even more important aspect of the healthcare industry within the years to come.